Am I audible? Yes, am I audible, guys? लेकिन दिख नहीं रहा है. हाँ, अब आ गया. Okay. So today we would be taking a topic which all of you have read in a slightly different manner. Yes, that is when we talk about epidemiology. In epidemiology, we have the master topic, that is study designs. Okay. Now study design is one which is a sure shot MCQ. You give any exam, whether it be the INICET, whether it be the Neet, whether it be the UPSC exam or the next exam, you will always get a question on study design. Now in our MBBS days, we are taught study design something like this. They will first teach us cross-sectional, then they will teach us longitudinal, then they will teach us ecological, then they will teach us case control, then they will teach us cohort, and then we have RCT. Okay, so in our MBBS days we are typically taught in this manner, but when we talk about our PG exams, the question is something else. The question will be, they will give you a clinical scenario, and in the option they will have A, B, C, D, and out of these they will have any of the questions. Study designs. Let us understand the approach to study designs. So if you get a question, okay, I hope it's all okay. Everyone can see. Yes. Okay. Now, if you get a question on study design, the first question which you have to ask is there a comparison group? This is the very first question you need to ask. Now, what does a comparison group mean? Suppose they are saying a study is being done in Gujarat. You have to see whether they have given a comparison group about Kerala, Jammu Kashmir, Bihar. They must have mentioned a comparison group. This is the first thing. So once you ask the very first question, and suppose you find out there is no comparison group, or there is comparison group which is present. If it is no comparison group, then we have to think about descriptive studies only. Now guys, what are the descriptive studies? Look into descriptive studies. If it's a rare or a common disease, like they're talking about Ebola, Zika, rare finding. They're talking about diabetes, cataract, common finding. And the sample size is 1, or the sample size is more than 1. If the sample size is 1, this becomes a case report. If it is more than 1, yes guys. So I hope you can see how beautifully we have followed a flowchart to come down to case report and case series. Now, what is the importance of this case report and case series? The importance is they are the first studies done for any new or rare disease. So there were 2 cases of COVID who had come to India from China. They were medical students to Kerala. So that becomes a case series. Yes. Imagine मेरी नाक यहाँ से बाहर आ जाए. Single abnormal finding. Case report. Yes. RCB wins a trophy. Case report. Yes. Hardik Pandya plays cricket for at least 2 months non-stop. Case report. We know always injured. Now guys, if it is a common disease, then we measure it in terms of snapshot. So what is a snapshot? I take a camera and I click a photo. So snapshot is something where exposure and disease are measured at same time. Exposure and disease are measured at the same time. So if it is a single snapshot or if it is a multiple snapshot, if it is a single snapshot, it becomes a cross-sectional study. If it is a multiple snapshot, it becomes a longitudinal study. Virat Kohli playing cricket, longitudinal study. Today Virat Kohli has scored a century, cross-sectional. Yes. So I can use a very simple example. If I say the weather of Delhi is very hot, it is longitudinal. If I say in Delhi today it is raining, it is cross-sectional. If I say in Delhi there is snowfall, it will be case report. Similarly, Salman Khan movie, blockbusters, longitudinal. सलमान खान किसी का भाई किसी का जान, फ्लॉप, क्रॉस सेक्शनल. Salman Khan doing good acting. Case report. We know it. I hope everyone is clear with it. So I've given you a cricket example, I've given you a weather example, I've given you a Bollywood example. Whichever example, you should be clear with the concept. Yes, guys. Now, cross-sectional study tells us about point prevalence, whereas longitudinal study tells us about period prevalence. Now, if they do not mention anything in the question, you should always consider it to be point prevalence. So how do we calculate period prevalence? It is incidence into duration. How do we calculate the point prevalence? It is the total number of disease divided by total population. Yes, into 1000. If I want to put it as a percentage, then I will multiply it into 100. Okay, guys, there are major mistakes in the Park textbook, so you should be very careful when you approach study designs, especially for PG exams. So see, our story started with no comparison group. Then we saw that they are called as descriptive studies. Then we saw whether it is a rare disease or a common disease. When it was a rare disease, we again divided into sample size 1 and sample size more than 1. If it was a sample size 1, it was a case report. If it was more than 1, it was a case series. If it's a common disease, it is cross-sectional. If it is multiple snapshot, it is a longitudinal study. I hope I am clear to all of you guys. No problem at all till now. Because now we will look into the next block where we are seeing that the comparison group. Now comparison group present, it can be a analytical study, it can be a analytical study or a interventional study. So what is a interventional study, guys? A interventional study is one where we have artificial intervention. Where we have artificial intervention. What do I mean by this? Your friend Neha Kiran, she takes lots of fresh fruits and vegetables. Natural intervention. Rose, kela, apple, banana, papita, she takes natural intervention. She came to the medical college, she read that omega fatty acid is good for heart. Now she is taking omega-3 fatty acid. So this omega-3 fatty acid is basically your artificial intervention. I hope I am clear with it. Looks fine. So the artificial intervention can be at the level of a patient. This is called as randomized control trial. It can be at the level of a normal person, which is called as a field trial. It can be at the level of community. It is called a community trial. Now guys, this group is the random group because again interventional studies of two types. It may be random or it may be non-random. Non-random, ठीक है जानवी कोई टेंशन नहीं है पीएसएम में यू कैन नेवर एवर फेल ट्रस्ट मी इन एमबीबीएस यू कैन नेवर एवर फेल अनलेस एंड अंटिल यू आस्क योर प्रोफेसर पूरे दिन करते क्या हो फेल यस और यू से मच्छर के काटने से कोविड होता है फेल यस अदरवाइज यू विल नेवर फेल इन पीएसएम रिलैक्स नॉन रैंडम दिस इज आल्सो कॉल्ड एज quasi experimental study. Quasi experimental study. Guys, this is also a MCQ. पूछते हैं what is quasi experimental study? It is a non-randomized clinical trial. So quasi experimental study, we have natural experiment. This natural experiment was the one which was done by John Snow and cholera. ठीक है? The second is cessation experiments. Cessation means suppose there is a person who smokes, you convince तंबाकू छोड़ो, जिंदगी चुनो, the person quits, and then you can see cessation experiments, evaluation studies, and pre-post clinical trials. Yes, guys. So this brings me to interventional studies. So you can see I am teaching you epidemiology absolutely in reverse order. The way we are taught in med school, I am teaching you in the reverse order. Okay. Now, when we look into analytical study, this analytical study, it depends upon what unit you take. If you take the unit as individual or you take the unit as a population. If I take it as a population, it is a ecological study. Yes, we say people of Gujarat are predominantly vegetarians as compared to people of Punjab who are non-vegetarians. People of the northeast part of our country are absolute super rock stars. Yes, people from Bihar prepare for IS and IPS examination. This is all about population level estimate. Now, if it is individual, it can be a case control, it can be a cohort. In the cohort, we have prospective, also we have advanced cohort. Advanced cohort includes nested case control and case cohort. Nested case control and case cohort. Yes, guys. This, my dear students, is the entire flowchart on approach to study designs. There is no MCQ book which gives you this particular approach. And that's the reason today in the med school, I have tried to take up something which is actually going to give you a lot of benefit. Yes, a lot of benefit. Yes, I hope I'm clear till this point. Now we will go ahead and look into difference between a case control and a cohort. Now, and a cohort versus a randomized controlled trial. Yes, in a case control, we compare cases with controls, whereas in a cohort we compare exposed with non-exposed. This, my dear students, is the main difference between a case control and a cohort. Never ever forget this in your life. So we go back in time and we ask for exposed, non-exposed, exposed, non-exposed. Yes, so we come from diseased to exposed. That is the reason this is called as retrospective study. Yes, and we do not have temporality. Now guys, what is temporality? Can anyone tell me? Can anyone tell me what is temporality? So temporality, it means first exposure and then disease. First exposure and then disease. Yes, like if I smoke, then I will have lung cancer. If you take Mukesh Kumar in your team, he is going to give 10 runs per over in against England in test. Yes, we know this. Whereas for a cohort, we have exposure, we follow up, and the patient will develop disease, non-disease. Yes. So we go from exposure to disease. This is prospective in nature and we have temporality present. Temporality is present. Yes, guys, I hope everyone is clear with the differences. So the first difference was comparison of cases and controls. Here it was exposed and non-exposed. Next difference was that one is a retrospective study, another is a prospective study. Third difference was in one we have temporality which is absent, and here temporality which is present. I hope I'm clear till this point. Now guys, let me make a very important point. This exposure is asked. हम पूछते हैं. So this is a very important keyword to recognize case control. They are asking the exposure. Like I will ask Surbhi, if she is a person who wears specs, that Surbhi, did you see excessive television in childhood? So I'm asking about the exposure. Okay guys. Now let us make the 2 by 2 table. A, B, C, D, A, B, C, D. Now in a case control, what did we compare? Cases and control. Yes, Anil. Suppose you are doing a study where you want to see that Surbhi is a person who is wearing specs and Anil is a person who is not wearing specs. Surbhi is also a medico, Anil is also a medico. Surbhi is 23 years old, Anil is also 23 years old. So we generally try to select the similar population. So if you take it from hospital, you will always take the controls from the hospital. You would not prefer to take them from the community. Okay, Anil. But please remember, this is not a theoretical thing. It depends upon what kind of study I'm doing. Based on that, I take my controls. In a cohort, it is exposed versus non-exposed. Now guys, let me tell you, in Park, they have given the opposite table. Even though you get the right answer or the same answer, that is not a right way to do it. It's always better to keep those things which are comparable on the left side. Now, so the 2 by 2 table of cohort is very, very important. Because if you, so odds ratio is AD by BC. Relative risk is A divided by A plus B, C divided by C plus D, incidence in exposed by incidence in non-exposed. Now, how did we get these formulas? At MCQ level, we don't expect you to know this. So what is the interpretation? Odds ratio. It is the odds of being exposed in cases divided by odds of being exposed in controls. So guys, you can see it is basically again cases versus controls, but both of them have to be exposed. So the cases are also exposed and the controls are also exposed. This was the best question which was asked in NEET 2022. Yes, so this is a very, very important concept. Yes, absolutely right. This is also called as cross product ratio. Now, what is odds? What is odds? Odds is P divided by 1 minus P. That is, probability event will occur divided by probability event will not occur. Yes, so this is what is the meaning of odds. Yes, guys, no doubt in this. Now, let us look into relative risk. Relative risk, the other name of relative risk is risk ratio. Now, again, in the exam, they prefer to ask you calculate risk ratio, and we start thinking, what is the examiner expecting us to calculate? So what is this? It is the incidence of disease in exposed divided by incidence of disease in non-exposed. So again it is exposed by non-exposed. But please see, guys, here also it should be diseased, here also it should be diseased. If you read Park or if you attend any other classes, you would never understand these tricky things, and that's the reason the examiner catches hold of our neck. I hope everyone is clear with this. No doubt, guys. I am now slowly taking you deeper and deeper and deeper, where we are trying to see more and more of comparison of case control and cohort. Is it okay? Is it okay, guys? No problem. Done. Should we go ahead? Okay. How do we interpret relative risk? So odds ratio, relative risk, association, name, example. More than 1, equal to 1, less than 1. Remember, odds ratio and relative risk can never be less than or equal to 0. No confusion in this. So this is positive association, no association, negative association. This is a risk factor. This is a null value. This is a protective factor. Yes. Risk factor, smoking and cancer. Equal to 1. Applying kajal in eyes of baby. Applying kajal in eyes of baby and big eyes. Less than 1, vitamin C and colon cancer risk decreases. Again, a very simple but important table, guys, for all of you. Yes, I hope I'm clear with this. No problem. Now, so we have seen till this point odds ratio, relative risk, risk ratio. Now, taking the story forward, types of cohort. Types of cohort. if nothing is given in question, we consider it to be a prospective cohort. Now, so types, we have concurrent and non-concurrent. Concurrent, two types, prospective and ambispective. Non-concurrent, also called as historical or retrospective. I'm going to draw a diagram which is not given in any MCQ book, and this will make your life very easy to identify types of cohort. So we go from start of study. So everything is related to my start of study. Exposure to disease, exposure to disease, exposure to disease. The first is called as a prospective cohort. So what is a prospective cohort? At the start, we do not have exposure, we do not have disease. First, there will be start of study, then we will have exposure and then disease. This is a ambispective cohort, where the exposure is there before the start of study and the disease occurs after the start of study. Here we have retrospective, where both the exposure and disease winning the World Cup. And my exposure is captaining the team. Okay. Now, if I talk about Shubman Gill has not yet been the captain of our country, definitely has not won the World Cup. So Shubman Gill will be the example of prospective cohort. Rohit Sharma, ambispective cohort, already has been declared the captain but has not yet won the World Cup yet. Retrospective, Thalaiva, MSD, yes. So this becomes a retrospective cohort. Now guys, the confusion happens in control. Now look, the direction of arrow is opposite, but we cannot expect you guys, the Nanna Munna guys, to pick up the direction of arrow in the exam. That is the reason we tell you tricks, and it is record based. It becomes a retrospective cohort. I hope I'm clear with this. Similarly, if we ask the exposure, it becomes a case control. I hope everyone is clear with types of cohort. Yes, guys. So you can see how in a different way I am teaching you the same thing which you have read, but I am approaching it the way examiner will ask you in MCQ format in the exam. Okay. Should I go ahead? Yes. If word review is given in the question, it's case control or retrospective study. Answer given in that MCQ was case control. Okay. Janvi, let's do one thing. You please share the MCQ with me. Let me see the MCQ, because just picking up a word, I would not be in the right position to tell you. So let me read the question and then I'll answer that. Yes, guys, please do not hesitate to reach out to me. This is my WhatsApp number and This is my Insta ID. So anywhere you are free to reach out to me. Okay. So do not worry at all. Okay. Now, taking the discussion forward, advanced cohort. So what is an advanced cohort? It is a khichdi design. I will say it's a khichdi design. Why? It is a case control study. It is a case control study embedded in cohort. So it is predominantly a cohort because there is a prospective direction. Now this is of two types. One, nested case control, and the other is case cohort. Now, what is a nested case? In which the controls are assigned the moment case occurs. The moment case occurs. Whereas in a case cohort, the controls are assigned. The controls are assigned at end of study. At end of study. Okay, guys. So suppose I'm starting a cohort in 2025, 27, 28, 29 and 30. Suppose in 2027 there is one case, 2029 there are two cases. In a nested case control, I will assign the control the moment case occurs. Whereas in a case cohort, the control. Okay. Done. I hope everyone can see it now. Everyone can see it now. Yes, excellent. Okay. So we will now look into the questions related to this topic. Yes, we will look into the questions related to this particular topic. Okay. Yes. So the first question, I hope all of you are ready for the questions. Here comes the first question. Can anyone answer me this particular question? Can anyone answer me this particular question? And tell me, why is your answer A, B, C, D? Tell me, why is your answer A, B, C, D? Divya, why? Tell me the why part as well. I just do not want only options. I also want the why component. Yes, anyone can tell me. This is the very first thing I have taught. Yes, okay. Very good, Divya. Very, very good. See, if anyone has answered case control, clinical trial, or cohort is absolutely wrong because there is no comparison group. Now, as there is no comparison group, you cannot mark the answer as option number 2, 3, or 4. So your answer will be 1, case series report. Yes, look, 5,000 patients, there is no comparison group. So the most important point, if you remember, I had told you, whenever you get a question, you should first check whether there is a comparison group or not. I hope I'm clear with this. I hope everyone is clear. Going ahead. Answer to this. Next question, guys. Answer to this. Answer to this. Yes. So everyone can see 1995, the exposure and the disease is in 2020, and the disease is in 2020. Yes, we can see over here that we are having the study in 207. So what kind of study design is this? What kind of study design is this? Yes, guys, this becomes a ambispective cohort. You remember I had drawn this image for you. Yes, Revati, Piyush, Divya, Shama, Parth, Iris. Is it okay? Is it okay? Can I get a response from you guys? Waiting for a response. Waiting for a response. I cannot see the response. Yes. Okay. Excellent. Excellent. Okay. Now I can see. Great. Good. Good. Next question. Answer to this. Next question. Answer to this. Answer to this. Next question, guys. Yes. Now, the keywords over here: asked and matched. This makes this a case control study. It cannot be a cohort at all. There is no intervention, so no art experimental. There is a comparison group, so can't be cross sectional. I hope I'm clear with this. So two important words: asked and matched. Going ahead. Answer to this. Answer to this. Yes, guys. So 2018, we are going to 2030 to 2040. It cannot be case control because we are going forward in time. It cannot be cross sectional because there is a follow up going on over here. So the best answer becomes prospective cohort. Now guys, if in this question we would have ambispective cohort, then ambispective cohort would have been a better answer. Yes. So if in this question we would have ambispective cohort, it would have become a better answer. I hope I'm clear with this. Next question. Have a look. Have a look. Another excellent question. Another excellent question. Ambispective. Please explain the why component also. Please explain why are you answering a particular answer. Yes. So if you see over here, you would see we have 3 villages. All the 3 villages are taken at a single point of time. So it is a section. So it becomes a cross-sectional study. Yes, I hope I'm clear with this. So it becomes a cross-sectional study. Next question. Next question. Next question, guys. So in this question, if you see, we are taking the whole country. Whole country means we are taking the population. Since we are taking the population, this becomes a ecological study. Yes, looks fine. No problem. Okay. Answer to this hint, you have to pick the keyword. Go ahead. Hint, you have to pick the keyword. Here, the keyword is records. Since it is records, it becomes a retrospective cohort. Now, there are many students who would try to be slightly over smart and try to find out the direction of arrow. Do not do that mistake. Because if you start doing that in the exam, you will be in trouble. Yes? Okay. Now, look into this excellent question. And this is the last question for today. I want to see who is the person who gets this right with the correct explanation. Yes, guys, let us see who gets this right with the correct explanation. Yes, guys, answer to this is an exquisite question. The last one, a future aims question, which actually tests do you understand the concept. The first thing, we have an artificial intervention. So it is not cross-sectional, it is not cohort, it is not ecological. You have to select between these two. Yes. Now. Anyone in this class who says it is a non-randomized clinical trial, can you tell me why are you saying it to be a non-randomized clinical trial? Yes, anyone can tell me whether it's a non-randomized clinical trial. Okay, everyone is with RCT. Now the question I want to ask in this question, can there be selection bias? Can there be selection bias in this question? Yes, guys. Do you think there can be a selection bias in this question? do you think there can be a selection bias in this question? Okay, Divya says no. Okay, anyone else? Anyone else? Okay, Surbi says yes. Surbi, can you explain why yes? Why yes? Okay, Parth also say yes. Okay, Parth, can you tell me why yes? Swapnil, why are you saying yes? Why are you saying yes? Parth, Swapnil, Surbhi, why are you saying yes that there can be selection bias? Now, please try to understand. Suppose I make you sit where the first participant is future doctor, then it is Dr. RJ, then it is Parth, then it is Suku, then it is Swapnil, then it is Revati, then it is Janvi. So future doctor got odd, Dr. RJ got even, Parth got odd, Suku got even, Swapnil got odd, Revati was supposed to get even. Now Revati is my younger sister. I said, Revati, you come ahead and let Parth go behind. So now Revati can get a odd intervention. So I did selection bias. Since I have done a selection bias, this becomes a non-randomized clinical trial. Because the biggest role of randomization, all of you have mugged up that randomization removes selection bias. AIMS just checked. Do you actually understand what is selection bias? INICET question always would be of the highest standard. Yes, so this is all for today. I hope you guys enjoyed the med school today, because trust me, no PSM teacher in your med school is going to teach you all this. So guys, do not miss the series and do not forget to subscribe to the DAMS Daily channel. Hit the bell icon, yes, and also we would love to see you guys in our discussion forums. Please do follow me on Insta, because I have just posted couple of updates today, Kilkari and mobile app. Yes, so I hope you have seen those updates. If not, go to my Instagram handle and followed it. Yes, and as again, probably in next 15 days, we will have another session. Yes, so thank you. Bye bye. See you. Love you all, guys.